What signal should I give you? Hi, my name is Samson Samuel, and this video is about the market for physician-owned hospitals and their services in the United States. The structure and the function of the current hospital system has changed and evolved over several years and decades. And the structure is provides inpatient care, outpatient care, ambulatory clinics, ambulatory services, and broad range of services including home health care. Now, in this complex American hospital system, there are various kinds of hospital structures. There are the non-profit hospitals which do not pay the real estate tax or the corporate taxes, and they also get subsidies from state and federal government. And there are some hospitals which are for-profit hospitals, but they're not owned by the physicians. Now, in 1990s, the physician-owned hospitals emerged. Now, this started by frustrated physicians with the traditional hospital system, with the inadequacies and inefficiencies and bureaucracies in the hospital. They used a fair market principle and developed or established physician-owned hospitals. Now, there are some barriers to entry for these hospitals, such as the certificate of need. There are certain states which, in which the hospitals need a certificate to open the hospitals. Now, most of these physician hospitals flourished in non-CON states, and they provided health care to many Americans, and the quality of care and their patient satisfaction scores were real high compared to the surrounding community hospitals. Now, the physician-owned hospitals pay corporate tax and the real estate tax. They also provide jobs for many Americans. Now, the American Hospital Association, representing most of the non-profit hospitals, did not have any good feeling about the physician-owned hospitals. Their lobbyists mischaracterized the physician-owned hospitals, saying that the cherry picking of patients and augmenting the physician services in these hospitals. They're taking away, their claim was that the physician-owned hospitals take away the revenues and the patients from the non-profit surrounding community hospitals. Now, physician-owned hospitals or specialty hospitals, some of them are spine hospitals, and some are orthopedic oriented or cardiac oriented hospitals. Traditionally, these hospitals are much smaller in their capacity, as the bed occupancy is much smaller than the national average. The workforce in these hospitals, the nurses and the physicians and the other workforces in these hospitals are geared towards that specialty and provide an excellent care for these patients and with good clinical outcomes. Now, they also have easy access. They also provide easy access to the patients. There is innovation and access to modern technology and access to modern surgical procedures to these patients. So most of the patients in this hospital love these hospitals. They have been rated, the physician in the hospital have been rated high in their scores for patient satisfaction and quality of health care. Now, the current healthcare Patient Protection and Patient Affordable Care Act, the current healthcare law, puts ban on the growth and expansion of the pre-existing hospitals, and also have put a halt to the new hospitals. With the result, the competition in the healthcare market is taken away, and the non-profit, the traditional hospitals do not want to compete with the physician-owned hospitals, which in turn affects the care and also cost of medical care. Section 6001 of Obama's healthcare law affects the physician-owned hospitals. The hospital, the economic model of physician-owned hospitals can be analyzed and understood by various factors such as consumer demand, barriers to entry, economies of scale and scope, and also the operating margins in these hospitals. Now, there are barriers to entry, which is done by the Obamacare for now. There is a high consumer demand for these physician-owned hospitals. The Supreme Court will take up the Obama healthcare next year and will decide about the constitutionality of the Obamacare. The ruling from the Supreme Court will have either a positive or negative impact on the physician hospitals, and also will affect the healthcare in the future. The debate regarding these hospitals, physician hospital, is ongoing, and the hospital services by the physician hospitals will in the future will have a great impact in the American healthcare system in terms of providing a good quality healthcare, which has improved the patient satisfaction and quality of healthcare, patient safety. All these scores are high in physician hospitals when compared with the community hospitals. And the outcomes in physician-run hospitals are also higher than the community hospitals. So next year we will know what this ruling from the Supreme Court and its impact on the growth and expansion of physician hospitals